Have you ever checked your blood pressure and felt confused by the numbers? Maybe it looks normal in the morning, but later in the day, it quietly creeps up. No symptoms, no clear reason, just a higher reading than you expected. You might be sitting still, watching TV, or even relaxing, and yet the numbers rise. So you start to wonder, am I doing something wrong without realizing it? This is where it becomes important, because one of the most overlooked factors is something you're doing every minute without thinking about it. You're breathing. Most people don't realize this, but the way you breathe throughout the day can influence your blood pressure more than you'd expect. And in some cases, small, simple changes may help bring those numbers down. But here's what makes this surprising. Not all breathing helps in the same way. In fact, some common breathing patterns may quietly keep your blood pressure elevated without you noticing, while a few specific techniques can help your body shift in the opposite direction. So how do you know the difference, and which ones actually work, in a way that's safe and practical? Let me share something useful right away. When you slow your breathing down, especially your exhale, you activate your body's natural relaxation system. This helps your heart beat more steadily and allows your blood vessels to open slightly. Here's a simple way to try it. Breathe in through your nose for 4 seconds, then breathe out slowly for 6 seconds. Do that just a few times. Many people notice their body begins to settle almost immediately. It may seem small, but this is one of the fastest ways to signal your body to relax. Hello, I'm Dr. Robert Miller. Over the years, I've worked with many older adults who felt frustrated by blood pressure readings that didn't always make sense. And what I've found is this: sometimes the answer isn't another complex change. It's a small, overlooked habit that's been there all along. Today, we're going to focus on one of those habits and how it may be affecting your body more than you think. In the next few minutes, you'll start to see how your breathing quietly interacts with your heart and blood vessels throughout the day. We'll look at why certain patterns may keep your pressure higher than it needs to be, and what most people tend to miss about this. And most importantly, I'll walk you through 3 simple techniques that are easy to follow, gentle on your body, and can be done right at home. By the end of this, you'll have a clearer understanding of what's happening and a practical way to start supporting your numbers, one breath at a time. Let's start with the basics. Blood pressure is the force of blood pushing against the walls of your arteries. Think of your arteries like soft, flexible tubes. When they're relaxed and open, blood moves through them smoothly, with less resistance. But when those tubes tighten or narrow, the same amount of blood has to push harder to get through, and that's when your pressure goes up. Now, this might sound familiar. Have you ever had a reading that was normal one day and slightly higher the next, without any clear reason? This is where it becomes important, because your blood vessels are not fixed. They're constantly adjusting, based on signals from your body. As we get older, those vessels naturally lose some of their flexibility. They become a bit stiffer, a bit less responsive. That's a normal part of aging. But it also means your system becomes more sensitive. Even small changes, like stress, posture, or breathing, can have a bigger impact than before. Now here's something many people don't realize. Your breathing is directly connected to your nervous system. That's the system that controls things like your heart rate, your blood vessel tension, and how your body responds to stress. So when your breathing is fast and shallow, your body may interpret that as a signal that something is wrong, or that it needs to stay alert. And in response, your blood vessels can tighten slightly. But when your breathing is slow and steady, it sends a very different message. It tells your body that it's safe to relax. And this is the part most people miss. This simple shift can influence how much pressure builds inside your arteries. Not all at once, but gradually and consistently over time. Here's something you can try right now. Nothing complicated, just a small reset for your body. Take a slow breath in through your nose for about 4 seconds. Let it feel gentle, not forced. Then breathe out slowly for about 6 seconds, as if you're releasing tension, little by little. Do that 5 times. No rush. Now, this might sound very simple, but this is where it becomes important. That longer exhale is what signals your body to relax. It tells your nervous system that there's no immediate danger. Let me ask you something. Have you ever noticed how your breathing changes when you're worried or focused? It often becomes shorter, quicker, almost held. and your body stays slightly tense. This exercise does the opposite. It creates space and gives your system a chance to settle. Some people notice a difference right away. A slight drop in tension, a slower heartbeat, a feeling of ease in the chest. Others may not feel much at first, and that's okay. The effect builds with repetition. Think of it like gently dimming the lights in a room, instead of switching them off all at once. And this is the part most people miss. It's not about doing it perfectly. It's about giving your body a consistent signal to calm down. Even a minute or two like this can begin to shift your state. Several studies, including research published by organizations like the American Heart Association, have found that slow breathing exercises may help support lower blood pressure over time. In simple terms, when you slow your breathing, you're helping your body shift out of a mild stress state into a more relaxed, balanced state. And that shift can influence how tightly your blood vessels hold. This might sound subtle, but it can have a real effect over time. Have you ever noticed your blood pressure reading is higher at the doctor's office, but lower when you're at home and relaxed? Part of that difference can come from how your body is responding in the moment, and your breathing plays a role in that. This is where it becomes important, because slow breathing isn't just about feeling calm, it's about creating a physical change inside your body. It helps your heart rate settle and allows your blood vessels to ease slightly. Now, this isn't a quick fix, and it's not meant to replace your medications or your doctor's care, but it can work alongside your treatment as a simple, supportive habit. And this is the part many people miss. Small, consistent practices like this often build up quietly over time and can make a meaningful difference in how your body regulates itself. You might notice when you're stressed or rushing, your breathing becomes faster and shallow, almost like your body is preparing for something urgent. That pattern sends a signal to your fight or flight system. This is your body's alert mode. It increases your heart rate and gently tightens your blood vessels, so blood can move quickly where it's needed. That's helpful in short bursts, but if it stays on for too long, it can keep your blood pressure slightly elevated. This might sound familiar. Have you ever gone through a whole day feeling a bit tense, even without a clear reason? Maybe you're sitting, watching something, or thinking, but your body still feels on. This is where it becomes important, because slow breathing does the opposite. It activates your rest and relax system, the part of your nervous system that tells your body it's safe to ease off. Your heart rate slows down a little, your blood vessels begin to open, and the internal pressure starts to settle. You can think of it like switching from a busy highway to a quiet side road. Everything begins to move more smoothly, and this is the part most people miss. Many people spend hours each day in a low-level stress state without even noticing it, not because something is wrong, but because their breathing pattern has quietly shifted. And over time, that subtle pattern can influence blood pressure more than expected. This may sound surprising. Breathing too quickly can actually lower carbon dioxide levels in your blood. Now, carbon dioxide often gets a bad reputation, but your body actually needs a certain level of it to keep things balanced. In simple terms, it helps your blood vessels know when to stay open. When you breathe too fast or too shallow, you lose too much of it, and as a result, your blood vessels may tighten slightly. This might sound familiar. Have you ever felt a bit lightheaded or slightly tense after breathing quickly for a while? That's part of what's happening. This is where it becomes important, because slow, steady breathing helps maintain a healthier balance of oxygen and carbon dioxide. Not too much, not too little, just enough for your body to function smoothly. You can think of it like adjusting the air in a room. If the balance is off, things start to feel uncomfortable. But when it's just right, everything works better. And this is the part most people miss. It's not just about getting more oxygen, it's about keeping the right balance. When that balance is steady, your blood vessels are more likely to stay relaxed, which can help support more stable blood pressure over time. Have you ever noticed your heartbeat feels different when you're calm? Maybe slower, steadier, more even. And then at other times, a bit faster or slightly irregular, especially when you're tense or focused. That's because your breathing is closely linked to your heart rhythm. In fact, every time you breathe in, your heart rate speeds up slightly, and when you breathe out, it slows down again. This is a natural pattern, but when your breathing becomes fast or uneven, that rhythm can become less stable. This is where it becomes important, because slow, steady breathing helps guide your heart into a smoother pattern, more predictable, more balanced. Let me ask you something. Have you ever sat quietly, taken a few slow breaths, and felt your heartbeat settle on its own? That's not just in your head. It's your body responding in real time. You can think of it like a gentle rhythm, like a steady drumbeat instead of a scattered one. And this is the part most people miss. This steady rhythm reduces strain on your blood vessels. When your heart and breathing are in sync, your system doesn't have to work as hard. And over time, that stability can help support healthier blood pressure in a quiet, consistent way. Let me ask you something. Do you tend to hold your breath when you're concentrating, watching something intense, or even using your phone? Many people do, and they don't even realize it. It's often very subtle, a short pause, a slightly tighter chest, then a quick breath again. This might sound familiar. You're focused on something, and your breathing becomes irregular without you noticing. Over time, these small patterns can repeat again and again throughout the day. And this is where it becomes important. Each time you hold your breath, even briefly, your body may shift into a more alert state. Your heart rate can change, and your blood vessels may tighten slightly. Not dramatically, but enough to influence your pressure over time. You can think of it like tapping the brakes over and over again while driving. Each tap is small, but together they affect the overall flow. And this is the part most people miss. It's not just big moments of stress. It's these quiet, repeated patterns that can shape how your body behaves across the day. Becoming aware of this is often the first step toward changing it. I once spoke with a 68-year-old man who noticed his blood pressure readings were higher in the evenings. At first, he assumed it was just age, or maybe something he ate, because during the day, his numbers seemed fairly normal. But in the evening, they would quietly rise. No symptoms, just a pattern he couldn't quite explain. So we looked a little closer at his routine, and this is where it became interesting. He spent a few hours each night watching TV, sitting still, barely moving, and without realizing it, breathing very shallowly, almost as if his body had gone into a passive, slightly tense state. Let me ask you something. Have you ever sat for a long time and later realized you hadn't taken a deep breath in a while? This might sound familiar because it happens more often than people think, and this is where it becomes important. It wasn't the TV itself, it was the breathing pattern during that time. Once he became aware of it, he started practicing slow, steady breathing for just a few minutes each evening. Nothing complicated, just a gentle reset before bed. Over the next few weeks, his readings didn't change overnight, but they became more stable, less unpredictable. And this is the part most people miss. Sometimes it's not a major issue, but a small, repeated habit that quietly influences the numbers over time. Another example, a 72-year-old woman who felt occasional tension in her chest, especially during stressful moments. It wasn't sharp pain, more like a tightness, a pressure that would come and go. She assumed it was just anxiety, something many people experience from time to time. But at the same time, her blood pressure readings were slightly elevated, not dangerously high, but consistently above where they should be. So we looked at the bigger picture, and this is where it became important. Her breathing during stress was often quick and shallow, almost like her body stayed on edge, even after the moment had passed. This might sound familiar. Have you ever felt tense and noticed your breathing becomes tighter without you meaning to? Over time, that pattern can keep the body in a slightly elevated state. So she began something very simple, just a few minutes of slow breathing, once in the morning and once in the evening. No pressure to do it perfectly, just a steady rhythm. At first, she didn't notice much, but over the next few weeks, something changed. The chest tension became less frequent, and her blood pressure readings started to come down gradually, not suddenly, but steadily. And this is the part most people miss. When you calm the breathing, you're not just relaxing your mind. You're also influencing how your body holds tension and how your blood vessels respond over time. Now let's go through 3 simple breathing techniques. We'll start with one of the easiest and most effective. Technique 1-4-6 breathing. Breathe in for 4 seconds, slow and gentle. Then breathe out for 6 seconds, unforced, steady, like you're releasing tension. Do this for about 5 minutes. Now, this might seem very simple, but this is where it becomes important. That longer exhale is what signals your body to shift out of alert mode. It tells your nervous system that it's safe to relax. Let me ask you something. Have you ever sighed deeply and immediately felt a bit of relief? That's your body naturally doing something similar. This technique just makes it intentional. You can think of it like slowly turning down the volume instead of switching everything off at once. With each longer exhale, your heart rate begins to settle, and your blood vessels may ease slightly. At first, it might feel a bit unfamiliar. That's normal. Most people are used to shorter, quicker breaths. But as you continue, your body begins to adjust. And this is the part most people miss. Consistency matters more than perfection. Even a few minutes a day can begin to train your body to stay calmer for longer periods. Technique 2. Box breathing, modified. Inhale for 4 seconds, slow and steady, through your nose if comfortable. Then hold gently for 2 to 3 seconds. No strain, just a soft pause. Then exhale for 4 to 6 seconds. Let the air leave naturally, without pushing. Pause briefly, then begin again. Now this pattern creates a rhythm, almost like a quiet cycle your body can follow. And this is where it becomes important. That short pause after the inhale gives your system a moment to settle. Not rush, not react, just reset. This might sound familiar. Have you ever taken a breath, held it for a second, and felt your focus sharpen? That's part of what's happening here. Let me ask you something. Do you ever feel your mind racing, even when your body is still? This technique can help with that, because it doesn't just calm your breathing, it also brings your attention back to the present moment. You can think of it like gently tapping the brakes and bringing everything back into control. Over time, this steady rhythm can help your heart and breathing work more in sync. And this is the part most people miss. It's not about holding your breath longer. It's about creating a balanced, comfortable pattern that your body can repeat without effort. Even a few minutes of this can help regulate both your breathing and your sense of focus throughout the day. Technique 3. Guided slow breathing. Use a simple rhythm, or even a timer or app, something that gently guides your inhale and exhale so you don't have to think about it. Aim for about 5 to 6 breaths per minute. That's slower than most people naturally breathe. At first, it may feel a little unusual. You might even feel the urge to speed up. That's normal. Your body is simply used to a faster pattern. This is where it becomes important, because slowing your breathing to this pace creates a steady, calming signal throughout your body, not just for a moment, but continuously for several minutes. Let me ask you something. Have you ever listened to calm, steady music and noticed your body gradually relaxing? This works in a similar way. The rhythm guides your system and helps everything settle into a smoother pattern. You can think of it like setting a gentle pace that your body can follow without effort. And the longer you stay in that rhythm, the more your nervous system begins to adapt. Just 10 minutes a day can be helpful. You might choose a quiet time, like early morning or before going to bed. And this is the part most people miss. It's not about doing more. It's about giving your body a few consistent minutes to reset and rebalance each day. Now you might be wondering, can this really make a difference on its own? It's a fair question, because most people are used to thinking in terms of bigger changes. But breathing works best when it's part of a simple daily routine, not by itself, but alongside a few supportive habits. This is where it becomes important. Your blood vessels don't respond to just one thing. They respond to your overall environment, what you eat, how you move, how you rest. For example, foods rich in potassium, like bananas or spinach, help your body balance sodium levels, and that balance can support healthier blood vessel function. In simple terms, it helps your vessels stay more relaxed instead of tightening. Magnesium-rich foods, like nuts, seeds, or even whole grains, play a different role. They help your muscles relax. And remember, your blood vessels have muscle in their walls. So when those muscles are more relaxed, pressure inside the vessels may ease slightly. Let me ask you something. Have you ever noticed how your body feels different when you're well hydrated compared to when you're not? Even mild dehydration can make your circulation work a bit harder. And over time, that can influence your readings. So staying well hydrated supports smoother blood flow and helps your system function more efficiently. And this is the part most people miss. It's not about one perfect food or one perfect habit. It's about small, consistent choices, working together in the background. Breathing is one piece of the puzzle, nutrition is another, and when they come together, they can support your blood pressure in a more stable and natural way over time. You may feel a calming effect within minutes. Sometimes, even after just a few slow breaths, your body begins to settle, your chest feels lighter, your heart rate a bit steadier. That's the immediate response. But when it comes to blood pressure, the changes are usually more gradual. This might sound familiar. Have you ever tried something new for a few days and wondered why nothing really changed? This is where it becomes important. Your body needs consistency more than intensity. Over a few weeks, with regular practice, you may start to notice your readings becoming more stable. Not necessarily perfect, but less unpredictable. Small fluctuations may begin to smooth out, and over months, these small habits can build on each other. Breathing, nutrition, daily routine, all working together in the background. You can think of it like gently steering a large ship. It doesn't turn instantly, but with steady direction, it gradually changes course. And this is the part most people miss. It's not about quick results. It's about giving your body time to adjust and respond in a more balanced way. That's where the real, lasting benefit comes from. This is the part many people don't hear. During a doctor's visit, your blood pressure is measured at one moment in time, a single snapshot. Maybe you've just walked in, maybe you're a little tense, or even just sitting quietly for a few minutes. That one reading becomes the number you focus on, but your body doesn't stay the same all day. Your breathing patterns shift constantly, faster when you're stressed, shallower when you're focused, slower when you're relaxed. And each of those patterns can gently influence your blood pressure. Let me ask you something. Have you ever had a reading at the clinic that felt higher than what you see at home? That difference can sometimes reflect what your body is experiencing in that moment. This is where it becomes important, because unless someone looks at patterns over time, including how you breathe during the day, these small influences can be missed, not because doctors overlook things, but because there's limited time and many important factors to consider during each visit. And this is the part most people miss. Your daily habits between appointments often shape your numbers just as much as what happens during the visit itself. Becoming aware of those patterns gives you more control than you might think. If you have existing heart or lung conditions, or feel dizzy while doing these exercises, pause and speak with your doctor. These techniques are meant to feel gentle, not forced or uncomfortable. In simple terms, your breathing should feel smooth and natural, never strained. Let me ask you something. Have you ever taken a deep breath and felt lightheaded or slightly uneasy? That can happen if the breathing is too fast or too forceful. And that's your body's way of saying, slow down. This is where it becomes important. You don't need to push yourself. There's no benefit in doing it harder or longer than feels right. A few calm, comfortable breaths are far more effective than forcing a pattern. If you notice any discomfort, tightness, dizziness, or unusual symptoms, it's best to stop and rest. And this is the part most people miss. These exercises are not about control, they're about ease. Your body responds best when it feels safe and relaxed. So always listen to how you feel and adjust as needed. If you've been feeling frustrated by unpredictable blood pressure readings, you're not alone. Many people experience this, especially as the body changes over time, and it can feel confusing when the numbers don't always make sense. But your experience is valid. This might sound familiar. You try to do the right things, eat better, stay active, and yet the readings still go up and down. This is where it becomes important. Sometimes, it's not about making bigger changes. It's about noticing the small patterns that happen every day, because your body responds to what you do consistently, not just once in a while. Your breathing is something you do every moment, quietly, automatically, in the background. But with a little awareness, it can become a simple, steady tool to support your health. You don't have to be perfect, just consistent. And over time, those small shifts can add up in ways you may not expect. And this is the part most people miss. Your body is always responding, even to the smallest signals you give it. Let me ask you this. Have you ever noticed your breathing changing during stress, or even when you're sitting quietly? Do you find it becomes faster or more shallow without you realizing it? I'd be interested to hear your experience. You can share it in the comments below. Sometimes, Just becoming aware of these patterns is the first step toward changing them.